The next speaker is going to be Dr. Wendemagegn Enbiale. He is no stranger to GLODERM, where he is the vice chair of GLODERM right now, as well as serving as the vice chair for the NTD Advisory Board of the Ministry of Health in Ethiopia. He's a professor of dermatovenerology and has over numerous years of experience focusing his career on multiple different aspects, including clinical, academic, research, and administrative responsibility. He's been engaged in community outbreaks, management, community-based research, operational research, clinical trials. He really is just does so much for the dermatology and the global community. He is also serving as the WHO, as a member of the WHO Strategy and Technical Advisory Group for the Neglected Tropical Diseases. And we're delighted that, so sad that he couldn't be in person, but delighted that he's joining us virtually and for his presentation.
Good morning. My name is Wendemagegn, dermatologist from Barda University, Ethiopia. In the next 10 minutes, I'll be talking about the advocacy work which has been done by health workers and organizations who are working on Noma prevention and control program in advocating to include Noma in the WHO NTD list. This is the outline of my presentation. As entry point, I'll be talking about the WHO proposed criteria for classifying a condition as an NTD. WHO, to include a disease as NTD, it has those 4 criteria. And the first of those criteria is the disease has to disproportionately affect population living in poverty and cause important morbidity and mortality. And the second criteria is primarily the disease has to affect population living in tropical and subtropical areas. Thirdly, the diseases are immediately amenable to broad control, elimination, or eradication by applying one or more of the 5 public health strategies adopted by the NTD department. And finally, the diseases are relatively neglected by the researchers. And in the summary, to speak about Noma, Noma is a rapidly progressing orofacial disease that affects the most vulnerable and marginalized populations worldwide. The global disease burden is not known, but Noma is preferably found in sub-Saharan African countries. The last report from 1990s indicated that the annual incidence was around 140,000, with around 700,000 cases of Noma sequelae registered globally. The people most at risk for Noma are preschool children exposed to other risk factors such as malnutrition and disease of poverty. And the disease starts as simple oral ulceration, and in 2 to 3 weeks period of time, if left untreated, it can result in either in 80 to 90% of cases, mortality. In the remaining 10-20%, they can have a lifelong disability and deformity. Importantly, oral hygiene is preventive, and early treatment can arrest the infection. These are the clinical presentation of Noma. There are 5 stages of the disease. In early case, when it presents as an acute active ulcer in the mouth with acute necrotizing gingivitis, but in short period of time, that can progress into gangrenous stage and scarring and sequelae, long-term sequelae, as you can see from the picture. In the last 30 years, there was some Noma control milestones, and the major milestones are in 1994, Noma is declared as a public health problem by the WHO. In 2001, development of regional Noma control program was established, first in 5 West African countries. Later on, 4 countries has joined the group. And in 2012, UN Human Rights Council initiative has declared human rights principle and guidelines to improve the protection of children at risk for affected by malnutrition or affected by Noma. The WHO African Regional Office developed a 5-point strategy which involves prevention, training, and epidemiology surveillance and etiological research and primary health and rehabilitation surgery. And those initiatives were primarily supported by Wind of Hope and Helfskytten Noma foundations. The objective of the regional Noma control program establishment and its achievement are first the development and integration of policies on Noma into national health policies through the oral health and disease surveillance program. And those countries has worked at improving the awareness of Noma as a disease and the change in Noma control policy influenced by the regional Noma control program in the countries. And have included, some of them has included Noma into the health professional educational curriculum, and some of them has improving the identification of Noma cases by health workers and communities. And regionally, they have worked in raising awareness about the disease, inspire new research, enable the formation of strategic alliance, and facilitate the planning of global response to this preventable disease. And globally, they have worked in advocacy and recognition of Noma as NTD by the WHO, with the goal which will provide pathway to remedying the neglect of Noma in the global health community, particularly in the field of research. And Noma should be an indicator for urgent action in terms of achieving the Sustainable Development Goal and ensuring the right to health. In those countries, even though it was really difficult to get the acute case surveillance, they have been reporting those cases which has undergone reconstructive surgery, as you can see. And since 2000, additional 3 countries from East Africa has joined the regional Noma control programs. In Ethiopia, in 2021, we did a rapid assessment in Noma cases who have undergone reconstructive surgery in the country for the previous 5 years. And we found out actually around 69 cases which has undergone Noma constructive surgery. So the process of advocacy to include Noma in the list of the WHO NTDs, it has involved the evidence generation on the burden of the disease by especially from those 9 sort of endemic country. And the dossier was prepared, led by Nigeria. And in January 2023, a request submitted to WHO Department for Control of NTDs through WHO country office and regional offices. And the NTD department has submitted the request together with the compendium of evidence to the NTD Strategic Technical Advisory Group at its annual meeting for review of the dossier and recommendation as to include whether to include the disease or not. And the 17th WHO NTD STAG meeting, which happened in last year in October, has a presentation by the Nigerian permanent representative in UN in Geneva of the evidence for Noma to include in the list of NTDs. And the ambassador stated that there is a hope for progress against Noma because it is preventable through knowledge about the disease and how to treat it, and it is treatable if detected and managed during the first week of the disease. And the ambassador also emphasized that the benefit of including Noma in the WHO list of NTD includes increasing research, resource mobilization, the establishment of national and international programs on Noma, more widespread awareness, alignment with the WHO World Health Assembly 76 Agenda, Pillar 1 and Pillar 3. So the discussion after the presentation there was a discussion after the presentation. The discussant agreed that there is no doubt that Noma is a seriously neglected issue, but the NTD notoriously suffering from lack of funding, integration into national programs, coordination in implementation measures. So the debts was whether Noma inclusion in the WHO list will unintentionally set this disease up for failure. So as an alternative strategy for better feeds should be considered, example, the nutrition or oral health programs, or a hybrid approach between those NTDs, meaning that Noma become an NTD, but a strong link with the nutrition or oral health program must be maintained. And the NTD and the non-communicable diseases oral health program would work together on it. And the discussant also suggested Noma could be added as a skin NTD, and that they have emphasized it also mapping is an urgent priority to advance on this. In conclusion, and the STAG committee has agreed that Noma is debilitating disease that requires urgent and comprehensive multi-sectoral intervention globally and locally to prevent, detect, and manage the disease. So the STAG has agreed that or recommended to the WHO Director General that Noma be included on the list of NTD as a Category A disease. On December 15, WHO released a press statement on the recognition of Noma as one of the NTDs. Thank you.